Welcome to All Home Care Matters, the show where we discuss all things home care, with discussions on important age-related matters and topics. Brought to you by Enriched Life Home Care Services, the #1 rated home care provider in Michigan by Top Rated Local.
Hello, and welcome back to All Home Care Matters. If this is your first time visiting us here at the show, we want to say thank you for taking time out to be with us today. We appreciate how valuable everyone's time is, and that's why we try and make each episode here at All Home Care Matters something that will hopefully matter to you. Today, for National Caregiving Month, we have two remarkable guests, Dr. Veronica Yank and Katy Plant. Welcome.
Great. Thanks, Lance.
Thank you.
You're welcome. So let's start with you, Katy. Why don't you share a little bit about your background and your expertise and what your current role is?
Sure. So I'm the general manager at Canary Health, and my background is public health. I've worked in academic research. I've spent a little time in nonprofits, and now I'm running our business unit that focuses on peer support programs, which we'll talk in a little bit, I think, about what exactly all that means. But our organization is a digital health company, and we offer caregiver support programs as well as programs for people with chronic health conditions. And we do it all on a digital platform, and have been doing it for about a decade now.
Wonderful. And how about you, Dr. Yank? What is your background in your current role?
Thanks, Lance. And do feel free to call me Veronica.
Okay.
So I am a physician scientist at the University of California, San Francisco. On my clinical side, I am a primary care doctor, and as such became very interested in caregiving research. And so in my role as a physician investigator at the University of California, San Francisco, I've collaborated now with Katy and Canary Health on various projects related to supports for caregivers of both veterans and then non-veterans with chronic conditions that require family or friend caregiver support.
Okay. So, Veronica, I see that you're an implementation scientist. For viewers and listeners who may not really understand what exactly that means and how it may apply to caregiving and to their situations, would you mind explaining that a little more in depth?
Not at all. So as a scientist, we try and develop and study interventions that can help people and their families and communities live healthier lives. So at the same time, some of those interventions that we demonstrate have a positive impact don't always get widely disseminated or implemented in the places where they can have the biggest impact. And so implementation science, and as an implementation scientist, I'm very interested in figuring out how to deliver effective interventions, supports, education to the people who most need them. And some of that can be through understanding how to communicate the benefit of a program to people, how to develop delivery mechanisms that actually reach the people who need them, how to build trust with patients and communities and families so that they understand that the intervention does work and could be something that they could benefit from. So that's the implementation science side. It's actually delivering effective, scientifically proven interventions and supports to the people who might benefit.
Okay, wonderful. And something that's so much very needed. I mean, we know about the roles and the responsibilities that especially family caregivers take on, and how there is not a lot of support for them, unfortunately, which is wonderful with the work that the two of you are doing in Canary Health. How did you both get involved with this, passion and, drive to work with caregivers?
I can start. So I got involved with it. Both Veronica and I at one point crossed over working at Stanford. And about a decade or so ago, the research lab that I was working in was approached by the VA, who at that time, the VA was trying to do this national initiative to pilot programs that address education and support for family caregivers. And they had these different pilot programs, I think a dozen or so throughout the US. And they approached our group asking if we would develop a caregiver support program. And this particular research lab I was in, we took a model that was previously used for people with chronic health conditions. It used peers and small groups. And the thought was, well, let's bring some experts in around caregiving, and let's adapt this program to see if peers in small groups could be effective in helping to relieve stress and other outcomes for caregivers. So for me, it was a professional journey. It turned in a bit into a personal journey a few years later. I have a son with a chronic lung condition that involves a lot of medication management, coordination with the healthcare system. So all these things that I was putting into my program became very useful to me, just not too long after we were working on the project.
Sure. And for you, Veronica?
So when I'm wearing my physician hat, caring for patients in the clinical environment as a primary care doctor, it, time and time again, it has struck me how, first of all, when family caregivers are involved in a positive way, in people's lives when they're trying to manage chronic conditions, the person with the condition typically does better. At the same time, I'm also a primary care doctor for those very same caregivers who are giving of themselves, and in some cases, honestly, forgetting their own care to support their care partner, whoever it might be, a spouse, a mom, a sister, a brother, or, in Katy's case, a son. And so I became really passionate about trying to figure out ways to support the family caregivers right along with their person, because, I see health as a family affair, as a community affair. And these caregivers were just really suffering, and I didn't have resources I could give them. So a lot of my research starts with that gap, I have a problem. My patients are suffering. How can I figure out a way to better address it? And Katy, I knew of Katy and the Stanford lab's work because I had overlapped with them at Stanford, as she said. And together, we embarked actually in a later stage on evaluating what was happening with the VA caregiver program and the online Building Better Caregivers program. And that was just a lot of fun and fed into some of my subsequent work. But yeah, it comes from the people. It derives from the people and the need.
Have you found, because it seems, and I don't want to generalize too much, but we help a lot of families throughout the state we're in here in Michigan. And so often, like you mentioned, the physicians, a lot of times it's at the primary care doctor's office. They're not given any real resources or anything tangible to help that family caregiver who, and like you said, they oftentimes end up suffering health-wise, physically, emotionally, mentally, because all of their energy and resources are going into caring for that loved one, whether it be a spouse, a child, or a parent. And do you find that more physicians that you speak with are starting to kind of get on board with trying to find more resources for these families that come into their offices?
Yeah, I would say they too, on the clinician side, the provider side, are hungry for support to give to their patients and families. So I really think they see the need. Sometimes it's interesting, I would say, because I do both research work in the health system environment, meaning in the clinical systems, the hospital systems, those sorts of places where clinical care is delivered, but also in community environments where, people are living and working the rest of their lives when they're not at a clinic. And I'd say sometimes those community environments are the best places for delivery of these supports because it's where people need the support. And so trying to make those connections between the health system and outside the health system and helping providers, first of all, know about what resources are out there so that they can help their these family caregivers understand that they are out there, and then building more even within the health system too. So yeah,
That's
I think
wonderful.
we're on board. It's just there's a matter of money and extension of building the programs. And
Absolutely. And, that kind of leads to my next question. And, Katy, I'm sure, having a child that you're also the caregiver for may be part of your motivation, but what motivates you and drives the two of you to help and support these caregivers?
For me, it's two things. It's definitely the impact that we make. A lot of the way that we do recruitment for our programs is through storytelling. And we have so many caregivers tell amazing stories of these, just the help that they got, the perspective of them caring for themselves. So I'm always very much in awe of the stories that they tell. And I also think back, I actually had my grandma Helen was a primary caregiver to my uncle, who is a Vietnam vet. He suffered a TBI. He suffered that in his 20s, and she was his caregiver for like 40 years.
Wow.
And I saw the impact it had on her health and the stress that it caused to family members. And at that time, there was even less support. And I just think about how much she could have benefited from a program like what VA Caregiver Support program is doing. And I know that it can touch a lot of lives. And so that's why we're out here at Caregiver Month, just spreading the word, because we really do want to make an impact.
How about for you, Veronica?
I would riff on what Katy said. Just knowing that in some cases the turmoil they are in, and wanting to help support them. I too, it's interesting. Before I even became a physician, it's clear in retrospect that one of my grandparents had dementia, had a flavor of dementia that is not the most common, and so. Early in my family's journey with that, we really had no idea what was going on. And it took a number of years to become clear on what was going on. But I think once I became a physician and then began to see these stories of my patients unfold, I remembered back to my family's story and thought, wow, if we had known more, if we had more support at the time, a lot of both my grandfather's suffering and honestly, my family members suffering, and confusion. It wasn't always suffering, but, just like confusion, lack of understanding on what to do to prepare for the future, let alone how to manage the present. So I think both the present day clinician experience, seeing my patients, and then also there are other family stories I could tell as well, or friend stories. But I think thinking back to my grandfather's experience and my mom and dad's experience with that is an important part of what drives me as well.
And I think is it fair to say that both of your personal experiences help to kind of guide you to being able to appreciate and understand what these caregivers are going through?
Absolutely.
Yeah. Why do you think it's so important to support family caregivers?
Veronica, do you want to start?
Sure. So I think we've talked a good amount already about just the health impact that caregiving can have. And so whether it's the physical, the emotional, it's all tied together anyway. The other thing is the ripple effects, I think, of that on both the person living with dementia, their loved one, other family members. For example, if it's somebody caring for an older parent, they may be caring for their own kids, and the kids are experiencing the impact of grandma or grandpa's, health issue, and perhaps, not understanding what's going on, and perhaps too, it's sucking away energy and attention, financial resources. Let's not forget those from other things the family could be doing. Sometimes people have to leave work or switch to working part-time because of family caregiving responsibilities. So I think all of those things are things that we care about and want to try and do better to create better circumstances for our families and communities.
Absolutely. And, like you said, it is a ripple effect. It starts oftentimes, every situation is different, of course, but it could be just once in a while having to help mom or dad out. And then it's becoming a couple times a week. And then now, your job is suffering and you might not be able to continue working and you lose your health insurance, or you don't have the resources to pay for your rent or your mortgage. And it just kind of snowballs quickly. And the next thing you know, you don't know what to do. And again, you don't know where to find resources like, the Building Better Caregiver program, or, it's such a needed, scenario for all family caregivers. And I just commend the tremendous work that the both of you are doing, because it's so, so greatly needed.
I think the populations that Veronica and I work with are military caregivers. And then Veronica works with caregivers caring for people with dementia, at least in terms of her research study. And I think both of those populations, military caregivers and caregivers who are caring for people with dementia, and on top of that in rural areas, which is what Veronica is focusing right now, they consistently experience worse health, greater strains in their family relationships, more problems at work, more likely to quit. So all of these caregiver problems that we know exist are even greater in those populations. And so that's another reason that it's just really important to focus and provide support to caregivers.
Absolutely. Absolutely. Would you both mind speaking a little bit to the family caregiver journey and kind of what that looks like? And I know every situation can be different and scenarios are different, but what would you say the general family caregiver journey looks like to you?
Yeah, I mean, I do think it's different for everyone. I think sometimes it's a role that you've chosen, and sometimes it's a role that's maybe chosen you. And I think the theme that we have this month with caregiving happens, when I reflected on that, what does that theme mean? I think caregiving can happen regardless of whether you're prepared for it or plan for it. And I think it also speaks to the fact that caregiving can happen to any of us, and it's happening to a lot of us. There's 53 million Americans right now that are family caregivers. In terms of that journey, I think a lot of times caregivers aren't necessarily identifying as caregivers until really at any part in their journey, but it's not necessarily at the beginning, right? You're a mom, you're a grandparent, you're a spouse, you identify in that way. And then once you realize the extra duties that you've taken on, that it really is its own right.
Your role has changed, right?
Yeah,
you're no longer the daughter or the son or the spouse. You're slowly becoming the caregiver. And then in those other moments, you're the daughter, son, or spouse. Yeah, absolutely. What would you tell our listeners and viewers are really the essential skills or tools for family caregivers to have?
I think you have to be a good detective, you really, and a good communicator. You're in some ways like solving a mystery of where can I get the resources that I need. And so having those detective skills, I think, is a major part of caregiving, because caregivers are constantly, they know that they need help, but they got to figure out when they need help, what help is needed, how to find that help. So I think knowing when and how to ask for help, organizing that help, and being able to find moments to care for yourself. Like, those are the skills to me that are pretty core. And that's what go into a lot of the work that we do in trying to relieve stress for caregivers. I know Veronica might have other things as well, as she sees them as patients.
No, I absolutely agree with all the things you've highlighted, Katie. And for me, sometimes in my brain, the way I organize it is there's sort of the self-care bucket, because you need to sustain yourself as a caregiver. And some of the things that Katie, mentioned, caregivers are very stressed out, and there's not a way to take away all of those stressors somehow magically, but just, are there techniques that you can learn to use to manage your stress, to manage your own doctor's appointments, to, recognize and take yourself off the hook maybe for some of your difficult emotions, healthy eating, healthy sleep, healthy exercise. Those are sort of the self-care things that we find a lot of caregivers completely forget about. And we talked about that earlier, than some of their own health aspects nosedive. And then there's the caregiving skills bucket, and being the detective. So educating yourself, or finding people who can help you learn about what's going on with your person. How do I manage their medications? Are they safe in the home environment? Are there, so I do a lot of work with caregivers who care for people living with dementia, and it's a progressive illness without a cure, so what do they need to prepare for next? The person seems relatively functional now, but do they want to start planning for the future, legal issues, in-home care, what are their options? Safety things that they can do around the house to make sure that their person is safe and everyone else in the home is safe. So I love the detective. I haven't used that before, Katie, but that's part of how can I find out these things? And are there people or programs that can help me with the different aspects I need to manage?
And that's a great follow-up to what is a good place for families to go if they're just getting started on their caregiving journey. Where would you send them?
I would say I would start with building a support system. So finding an outlet to be able to talk to other caregivers who've been there and can offer useful, maybe tactical, emotional support. And there's, if I was to send someone somewhere, so it'd be two things. It would be like, let's figure out where I can get support for building my support system. And then what help do I need? And so making that list of, because then depending on that answer, then it tells you where to go. So one resource I think that we always give out is the Elder Care Locator. And this is a place where you could go, you can put in your zip code, and it will, usually it's going to bring up your area agency on aging. That calling that one number can open a lot of doors in terms of what you decide you need help with. You need help with transportation. You need help with respite. You need help with food delivery, whatever those things that you've put on that list, calling that Elder Care Locator can help. And then, programs like VA Caregiver Support, disease-specific organizations like the Alzheimer's Association, the American Cancer Society, those are also places where you can work on building your network of support, finding support, people like yourself who've walked in your shoes that can give you a stable base of okay, what do I need to do to be my strongest self to then be in a place to be a caregiver?
Yeah.
And one other one I'd like to plug, because I agree with all of those. There is a nonprofit organization called Family Caregiver Alliance. While their home base is in San Francisco, they have a lot of their remit for some of their services is the entire United States, and they have some online videos and other resources, because I completely agree with Katie that there's sort of disease-specific programs. She mentioned the Alzheimer's Association. They have really nice online resources for dementia caregivers. But the nice thing about Family Caregiver Alliance is some of their materials span lots of different types of caregivers.
Right.
So that might be another good one to look up when you're just starting your caregiver journey, and then checking back with as you go along it.
Okay. And I saw that a lot of the work you do talks about the power of peer support too. And you mentioned it kind of with the caregiver support group. Tell me more about what we call the superpower and how you're defining a peer.
Sure. I can start. How we look at peers. A peer is really someone who has had family caregiver experience themselves. They may or may not be a health professional, but for being a peer, they're taking that hat off. So if they're a retired nurse, I would say they're a peer because they're a caregiver, not because they're a retired nurse. And for our programs, those peers who are caregivers themselves, they have gone through not only are they living, have kind of a shared life experience because they're both caregivers, they've taken one of our 6-week courses, and they've enjoyed the workshop, and they've gotten so much out of it that they decide that they want to take kind of a bit more of a leadership role in helping to facilitate the workshop.
Wonderful. And then I just wanted to touch on a resource I was thinking about. We spoke with a couple of their directors a while back. California specifically has a wonderful organization, the California Caregiver Resource Centers.
Yeah, so the Family Caregiver Alliance I mentioned is the one. So it kind of has, that's what I meant about it has two roles.
Gotcha.
It's a resource center for the Bay Area. And then it has this even larger umbrella role, but you're absolutely right. And other states do have various iterations of that. So with my project on rural dementia caregivers, we're actually working closely with some of those, a version of that in North Carolina as well, where they have caregiver support experts. The VA throughout the VA system has caregiver support coordinators, but it's really hard, Lance, because state by state, it's organized differently. And so I would tie back to what Katy said about for those caring for an older adult with conditions, that elder care locator is a nice resource, but it is hard to suss out for your state in some cases.
Right. Yeah. And even I know from the home care sector, every state is different. Half the country is licensed, the other half isn't. And that means some states are not regulated by the Department of Health and Human Services, which is frightening because the average family, they don't know what they don't know, right? And if they're in a state like Michigan and companies aren't regulated, and when I say licensed, I don't mean they don't have a business license. I mean they don't have a healthcare license to practice, and they're not regulated by Health and Human Services. So there's no guidelines to follow. They follow the guidelines they set forth in their own company, which is just not right, and hopefully we'll see those changes too as more and more awareness gets shined on these family caregivers that need help and support. What would you say, Katy? I see that almost, and this is a staggering number, almost 15,000 caregivers of veterans have taken the Building Better Caregivers workshop. Yes, applause and kudos to you and Canary Health. Can you tell us more about the program, who's eligible for it, and how our viewers and listeners can sign up?
Yeah, absolutely. So yeah, we're really proud of that number. We've been working with VA Caregiver Support Program for close to a decade now. So it took that amount of time to get that many people through. And in recent years, more and more are starting to hear about it because we're doing, interviews like this because they go a long way in spreading the word. But what the program is, I know previously you asked me kind of what is the superpower of peers? Do you want me to answer that one? And then I can go into it. So what Building Better Caregivers is a 6-week program that caregivers go through asynchronously, meaning not like today where we all got on at the same time and we're talking. It's asynchronous. So caregivers can log on whenever they want. It's a small group. So it's a small group of about 30 caregivers from all across the US. And it's facilitated by 2 peers. And I'll talk a little bit about peers. So I talked about the definition of a peer is really someone that has a shared experience and that they are also a caregiver themselves. And there is this power, and you can think, I kind of always relate it to, when you're in school and maybe you're in a class and the professor is talking or the teacher's talking and you're learning information, but it really takes like going into those peer groups. Maybe you have some office hours where you actually like start to digest and apply the skills. I think peers are a really good role model. And that's partly why we use them, because you can identify with them. If someone is telling me, sharing an experience that they've lived versus someone telling me what I should be doing, I'm much more likely to listen, and I'm much more likely probably to incorporate the suggestion that they're asking of me. So we use peers because peers, we do think that they serve as really good role models. They provide authentic and supportive messages, and they themselves benefit from providing the service and providing the program. So our small group of Better Choices, Building Better Caregivers, has 30 caregivers, facilitated by 2 peers. Caregivers are asked to log in about 2 to 3 times a week for a total of 2 hours. And when they're doing that, they're going through lessons. We've talked about things that are challenges for caregivers, whether that be communication skills, those detective skills that we talked about, self-care, exercise, healthy eating, all of those things. We take little nuggets of it every week, and we divide up those lessons into 6 weeks of content. And so you go online at your own speed, you go through the lessons. And then really the magic of it is that you're in this group with 30 other caregivers that have experienced similar challenges and success that you have. And it's this sharing that goes on. So every week people are asked various problems that they want to share, and they get lots of input from the other people in the group. They're also asked we do these weekly action plans. And this is kind of fun for caregivers because often they're not really in a headspace to focus on themselves. They're always focusing on their care partner. And
Sure.
Action plans and goal setting for the week, it gives them an opportunity to do something for themselves, whether that's call a friend, find respite, whatever it is. We help them to define that goal, and they come back the following week and they tell us how it went. And if it went well, great. If it didn't, then we problem solve. Okay, how could we help you to accomplish that goal? And it goes on like that for 6 weeks. There's also an alumni community that people join when the program's done.
Nice.
And in terms of who's eligible, so the VA Caregiver Support Program is offering this to caregivers of veterans. You have to be enrolled in the Caregiver Support Program. So what happens is someone will go to our website, and I know you're going to have a link at the end. They can learn more about the program. If they're not already part of Caregiver Support Program, meaning they don't have, they have a social worker that is assigned to them and their veteran. If they don't have that, it's okay. They can learn about the program from us. We'll alert the Caregiver Support Coordinator at the VA. That person will get in touch with the caregiver. They'll sign them up for the Caregiver Support Program if they're not already signed up. And they'll just double check a few things to see if they qualify. And those things usually are that they are caring for a vet, that their vet is receiving VA healthcare. And that's pretty much the minimum of it. Those two, plus being enrolled in the VA Caregiver Support Program.
And just to follow up, and there is no cost for signing up either, correct?
No.
Yeah.
No cost. Sometimes there's a bit of confusion. So the VA Caregiver Support Program offers 2 different programs. One is a program of comprehensive assistance where they, among other services, they're giving a stipend to caregivers. And they also have a program that's a general program that has all sorts of good things in it, our program included. And sometimes people get confused between those 2 things. So bottom line, if you want to sign up, you come to our website, we connect you with the VA, and within probably about a week, you get to start the workshop if you qualify.
Tremendous. And it's really a remarkable program. I've been researching it and reading about it, and, this is really what every caregiver needs, right? They need that peer with those superpowers and knowing they're not alone and being given that support, because it's not only the support, but it's also letting them know they're not alone, right? We encounter so many families with the caregiver support groups that we facilitate, where most often one of the most common themes that we encounter with people that first sign up or they're attending their first group, their friends don't understand. The brother or sister or even the children live in other states, so they're not seeing firsthand what that family member's going through caring for that loved one, and they just get a sense of relief just knowing they're not alone. Sometimes that's, a superpower in and of itself.
Yeah, absolutely.
So after offering this program for 10 years now, is that right, Katy? 10 years?
For the VA, yeah.
Yeah. And providing this to so many caregivers, are there any moments for you or for you, Veronica, where it was like, like an aha moment, like this is it, and or even developments that you've improved on or have added over the years that have really resonated as like an aha moment for you?
I can think of two. I think one, when we were originally developing the program, we do focus a lot on what problems and challenges do you have, but caregivers have also had a lot of celebrations. Many take a lot of pride in what they do. They're serving a tremendous role, and it's good to celebrate those as well. So one of the program adoptions we made at some point was adding the ability to share those successes. Right. And so now we have, I talked about the content, but there's also a discussion area, and we have like a carve out of the discussion area that's talking about those celebrations and sharing those stories. And I think the other aha moment that comes to caregivers, it really is that they're not alone. We hear that time and time again. They're feeling so isolated, and it's just, they can't even believe that there's so many other people out there like themselves. Right. That every single workshop that we have, when we ask people what they get out of it, it's like two things. It's, I had no idea there's so many people like myself, and that they felt really just the power of helping someone else. They do help someone else in their caregiver role all the time, but to be able to connect in that way and have learned something about their caregiver experience and share it with something else is just really powerful.
Absolutely. What would you say is one of the greatest benefits? And I think you kind of touched on it in that answer, but if you had to list one or two of the greatest benefits of the program, what would you say those are?
I would say realizing that you're not alone. And so having that support around you, the realization that it is important to take care of yourself so that you can be a strong caregiver to your care partner. So all of those self-care skills around taking time for yourself, whether that's with exercise and eating well, and being a good communicator. I think that's one of the values that people take out of it. I'd say the last thing is that, particularly because we focus on caregivers that are caring either with dementia, or many are caring for traumatic brain injuries or PTSD, that a lot of their stress comes from their care partner's difficult behaviors. And so we spend a lot of time on that. And I think people start to realize that it's a symptom of the disease, and it's not, they're trying to be mean to me or whatever it might be. There's this just realization of it's part of the disease, and there's some things that I can do to de-escalate and provide stress, not be so stressed in that moment.
I was going to piggyback on a couple of things. Is that okay, Lance?
Absolutely. Yeah.
Yeah, because you asked about aha moments, and I absolutely support everything Katy has said. I think one of the things when we were overlapping doing an implementation evaluation several years ago now of this amazing VA Building Better Caregivers opportunity, some of the caregivers who were at that far end of feeling isolated and who just raved in the interviews we did about the ability to connect with peers and learn from peers and pay it forward, like Katy said, their own getting gratification from sharing their own lessons learned with others so it might benefit other caregivers. Were the rural caregivers of veterans. Not to say that caregivers in urban or suburban environments don't have innumerable challenges of their own, but just if you're living in a small town with 300 people, it could be highly likely that there aren't other caregivers going through your same experience. And so that is one of the aha moments for me that led me to want to build the Rural Dementia Caregiver Project and adapt this amazing workshop that Katy's been describing for rural caregivers in rural communities. So that's one thing. The other thing I'd say is just to elaborate a little bit more on the lessons that they take from the workshop and carry forward. So we've been doing, with my particular project, we've been doing what we call debriefing or exit interviews, but it's actually because they exit our project so late, it's often a year to a year and a half after they've even taken the workshop. And in some cases, because we work with the caregivers of loved ones with dementia, their care partner may have even passed away and when we're interviewing them. And so some of the aha moments from these recent interviews we've done have been just in how they've been able to translate some of the skills and learning they develop, the communication skills, the self-care skills, that it's even, they've described how it's even carried them through the grieving process and kind of reintegration into a new self. They were caregiver, and then that poof went away. And so anyway, it doesn't mean that, my point is that's an extreme example though of how some of the ingrained lessons get applied to other areas of people's lives.
Absolutely. Right.
Other relationships that may be there.
So Katy, how do our viewers and listeners sign up for the Building Better Caregiver program?
Sure. So they can either go on their phone, on their tablet, on their computer, and visit va.buildingbettercaregivers.org. And that will take them to our main landing page where they can learn more about the program. They can look at some videos of people that have gone through the program. To qualify, they do need to be caring for a veteran. That veteran needs to be receiving VA healthcare. And eventually, if they're not already, they'll need to sign up. The caregiver will need to sign up for the VA Caregiver Support program. So they'll click on the link. It'll take them to just a real small screener. And from there, if they're eligible and interested, they'll get connected to a staff member at VA Caregiver Support who will just do a little review with them and send them an invitation to pick a workshop. And we have workshops that start pretty much every Monday. So very little waiting time.
Wonderful. And would the spouse of the veteran also be able to sign up if they're caring for the veteran?
Oh, absolutely. So it's anyone who is caring for the veteran, the caregiver of the veteran, whether that's a spouse, whether that's a son or daughter, grandchild, whoever that might be that's in the caregiver role. That's who's going to the website.
Terrific. And Veronica, how do families sign up for the Rural Dementia Program?
Yeah, for the workshop focused on dementia caregivers, they have a number of options. So we do have a toll-free number that goes to a person, Elizabeth. That number is 833-634-0603. If Elizabeth doesn't pick up, she will call you back. You can also text that number if that's your preference. And then we have an online site as well, where you can learn more and do a brief screener similar to what Katy mentioned. That address is https://caregiver project, all one word, caregiver project, all one word, then .ucsf.edu. And I know you'll flash that on the screen.
Yes, we'll have it up.
One thing I want to emphasize about the rural caregiver workshop is that it does not require high-speed internet access. You can access it on your phone, tablet, or computer using minutes or broadband access. Either way, it will work for you.
And I think that's remarkable because, I have family that lives in very rural areas, and they encounter access issues all the time. And they have to drive a half an hour, sometimes even an hour or longer to get to specialists or different resources. So that's remarkable. It does raise a question in my head. If someone in a rural area listening or watching this has a loved one with dementia and they're also a veteran, would they sign up for the Building Better Caregiver program, or would they sign up for yours, or both?
I think the world is our oyster a bit. What I will say is yeah. So if they qualify for ours and they want to be in a workshop with other people caring for, loved ones living with dementia in rural communities, that might be a distinguishing feature of ours. and then Katy can talk a little bit more, the veteran directed Building Better Caregivers online workshop, accepts more all comers other than by condition of the care partner. But then
I think the commonality would be if you want to connect with other caregivers of veterans, and that's important to you to be in that community, then that, come to the VA one. If it's more around connecting with others in a rural area that are caring for people with dementia, and it is very disease specific, then you can go that route. But there's a choice and whatever.
But they could technically do both.
I think for the study reasons, she couldn't have that. Yeah.
Okay.
They wouldn't be able to be simultaneous. We do ask them a question. We don't. So it is a study, and there's a ton of overlap in some aspects of the workshop between the two. But we, in addition to being a study, we feel like it's a resource. So we welcome all people who qualify. At the same time, we also want to make sure that we have room for everyone, and we wouldn't recommend being in both at the same time.
All right. I was just curious about that, because I could see benefits to both, right? You're specializing in the rural for dementia, but maybe I'm taking care of a wife and I'm a veteran and I would love to bond with other veterans, so no, that's remarkable. I mean, both programs are just so greatly needed and such wonderful resources. And it's wonderful that there's no cost to these families to benefit from them. We're going to be sharing this resource far and wide on all of our social media and all of our podcast platforms, as well as our YouTube channel. And I just thank you both tremendously for for your time, but also for the wonderful, wonderful work that you've undertaken to help these families and these caregivers with this journey.
Thanks, Lance. Appreciate it.
You're very welcome.
And right back at you. Thank you for all you are doing.
Thank you. It's our pleasure. It really is. And it's a passion. It's something you have to have a passion for. And it's very evident that both of you do. And
thank you.
And we look forward to talking with you guys in the future.
Thank you.
You're very welcome. Thank you, Veronica. Thank you, Katy. Have a great day.
All right. Take care. Bye-bye.
Right, bye-bye. Thank you for joining us today here at All Home Care Matters. All Home Care Matters is here to help families as they navigate these long-term care issues. We invite you to visit us at allhomecarematters.com, where there's a private, secure, fillable form where you can give us feedback, show ideas, or if you have questions. Every form is read and responded to. And remember, you can listen to the show on any of your favorite podcast streaming platforms or watch the show on our official YouTube channel. Just make sure to hit that subscribe button so that you never miss an episode. We'd also like to thank Dr. Veronica Yank and Katy Plant for joining us today for National Caregivers Month to discuss these remarkable caregiving resources for families and their loved ones. We look forward to seeing you next time here at All Home Care Matters. Thank you.
Thank you for joining us today. We look forward to you joining us again on another episode of All Home Care Matters. To learn more about the show and to connect with us, visit us at allhomecarematters.com.